Welcome back to the Ed Show. 10 a.m. tomorrow. That's the time. That's when House Speaker Nancy Pelosi and Democratic leaders will unveil the House health care bill. I can't wait. But it probably won't have a robust public option. Doesn't make me happy. We have 256 Democrats in the House, but we can't find 218 votes for it. Progressives are furious. Some are saying they won't vote. They will not vote for a watered-down bill. And I can't believe we're having this conversation right now. Universal health care is the cornerstone of the Democratic Party platform. Now, I think Congressman Dennis Kucinich has it exactly right. He issued this challenge to his fellow House Democrats today. Quote, if this is the best we can do, then it's time to ask ourselves whether the two-party system is truly capable of representing the American people, or whether the system has been so compromised by special interests that we can't even protect the health of our own people. Congressman Dennis Kucinich of Ohio and former presidential candidate joins us here on the Ed Show tonight. Congressman, what are you saying with that statement? Is it time to break away from the Democratic Party on this one issue on health care? Are you ready to make that move?
It's time for all of us to redouble our efforts to insist that we take a stand for a robust public option. That's the least we can do. Many of us started with a single-payer proposal. And, of course, I've tried to get in the bill a guarantee that every state would be able to have a single-payer option. But that's been taken out of the bill. Now we're left with this negotiated rates, which by the time they get to a conference committee will end up being a trigger, which ends up being a total capitulation to the insurance industry. Democrats ought to take a stand. What are we here for?
Well, you've got rural conservative Democrats out there who want these negotiated rates, and they want the power to go to the states, and they want 50 different associations, and you say that's a victory for the insurance industry. You couldn't go along with that. Would you vote against that?
Well, I'll tell you, I would have great trouble voting for anything other than a robust public option, because that saves money. It provides more health care for more people. Otherwise, what we're looking at, Ed, is we're looking at the poor having to pay more. We're looking at the government having to pay more. This ends up being a larger bailout to the insurance industry. I don't think that's what Democrats should stand for, and I'm hopeful that even at this late moment, that the leadership will calculate again, take that count again, and be willing to roll the dice and take a stand to see if you can get 218 Democrats to stand for a robust public option.
What role does the President of the United States play in this, in your opinion, right now? Is this the time for him to step up? If tomorrow at 10 o'clock and we're hearing that it's not going to be a robust public option, what the heck did we work for Obama for? I have to ask that question. How do you feel about that?
Well, you know, first this starts with a congressional process, and it would help if the president made a statement on this, of course. But we can't get away from our responsibility as members of Congress who have pledged to deliver health care to the American people, and we've got to make sure it's health care, not insurance care. We've got to make sure that the American people know that we want everyone covered with the best plan that we can possibly have, and frankly, I think that we're selling ourselves short by not going forward with a robust public option.
Okay, but Congressman, I want to be very clear tonight. Do you think that there are liberals in the House that will say no to any kind of reform unless it has the kind of public option they want? I'm talking about you and Lynn Woolsey and maybe even Congressman Weiner from New York. I mean, there's some staunch lefties there that have worked hard for health care reform, and if you don't get a robust public option, would you vote against the bill? Do you think there'll be maybe 30 or 40 that maybe could screw this whole thing up? What do you think?
Well, we're not talking about screwing it up. We're talking about unscrewing it to make sure that the insurance companies aren't going to raid the American taxpayers' coffers. I want to see how this bill reads tomorrow, and then tomorrow I'll be able to give you an assessment as to how I'm going to vote.
Okay, we may be calling you tomorrow because I think, you know, you've been a solid voice on this all along. Congressman, I appreciate your time.
Thank you very much, Ed Schultz.
For more, I'm a single-payer guy. I mean, I am, and I think the congressman is exactly right. We've just capitulated too much. Bill Press, radio talk show host with us tonight. Also, Steve McMahon, Democratic strategist, and John Ferry, Republican strategist. I'll go with you first if I can, Bill. Is this a defeat? If it comes out what we're hearing tonight about no robust public option coming out of the House side, is this a defeat?
Looks like it. I'll tell you one thing, Ed. To me, I'm with you. I'm a single-payer guy. I think this shows the mistake of not starting with a single payer. Because they have started with a single payer, then they could have worked their way down. Instead, they started out with a public option, and now it looks like they're even going to water that down. Here's what I don't get, Ed. Democrats are the majority party. They're dealing and they're operating like the minority party. They're not using their power, particularly in the House. There's no reason, in my judgment, for the House to come in with anything other than the strongest possible bill, because you know damn well when it gets to the Senate, that's when they're going to have to compromise. So to start out weak in the House, I think is a defeat, and it's sort of a repudiation of all the work that progressives have done for the last 9 months.
You think lefties are going to turn on this? What do you think, Steve?
I don't. Listen, I think that for people like me who came to Washington, I worked for Ted Kennedy for a long, long time. And Ted Kennedy, to him, health care reform was all about getting everybody health insurance and getting everybody basic health care. Now, this may not be the bill that makes the progressives happy. I'll freely acknowledge that. But it is a bill that moves 45 million more people into health insurance and gives those people health care. They haven't had it before. And I actually think that this is a situation where Speaker Pelosi is bowing to pragmatism. She wants to get a bill passed. She did the vote count. She's done the arm twisting. And this is what she thinks she can get done. And you know what? It may not be perfect, but it's pretty damn good.
Victory for the conservatives, John?
Well, not necessarily.
No, they want nothing. They want nothing.
Well, hold on. Let me speak for myself.
You knew reform was coming. I mean, you knew something was going to get done.
Eddie,
this is watered down.
And how many times have I come on this show and said, I want reform. I don't want the public option, and I want something that's not going to bankrupt the country. Now, I think that they're bowing to reality, which I said last week, that Nancy Pelosi said they want a robust option. Steny Hoyer said, we'll see what we can do. And now they're seeing what they can do, and they can't do what they want to do. I mean, this is, to Bill's point, they can never get single payer done. They can't get a public option done. They're trying to get incremental reform. And you know what? I think that we should get incremental reform. I wish they would do something that would actually bring down costs and competition, which would be interstate, allow across state lines, those kind of reforms, something with malpractice reform, those type of reforms that actually bring down costs and not bankrupt the country.
Unless you force it. I'm not going to go into your territory. You're not going to come into my territory. That's how the industry has worked in recent years.
I think
and that's wrong. But this idea that the rural folks are winning on this Medicare reimbursement rate, so they're going to hold up reform because of it. Why don't they just pass this thing, Bill, and then go back in the next few years and work on the Medicare reimbursement rates? Heck, we got money for everything else.
No, absolutely. Or do it at the same time. I mean, this is the tail wagging the dog. Absolutely. If the Medicare system is broken, and it is when it comes to some of the reimbursement rates in some of these rural states, Ken Conrad keeps talking about North Dakota. Well, then fix it in North Dakota, but don't make the whole rest of the country suffer because of the Medicare rates there.
All right.
But again, Ed, I just said, look, I've been around the legislative process a long time. I started in the legislature in Sacramento. I know you have to compromise at some point. What bothers me here is they're compromising before they even get to the vote. You compromise at the end of the process. To me, you don't start out with a compromise.
If you had started with the single payer, it would have been a non-starter. It wouldn't have gotten this far. The Obama administration stands out there every day and says, it's amazing how far we've gotten. We're so close. And they're absolutely right. It's never come this far. You can argue maybe they compromised early or maybe they compromised too much, but we're going to get a health care reform bill. People are going to get health care, and they're going to get health care coverage that they haven't had
one little suggestion. I wrote a piece in Politico today about it. Have an open process in the House where everyone votes on that thing, no backroom deals, have it incremental, have all kinds of amendments, and see what happens. You might get a public option that way. You might get what we want that way. But have an open process. These backroom days.
Want besides nothing?
Well, they want a lot of stuff. They want get rid of pre-existing conditions.
Where's the plan?
Where's the Democrat plan? We still haven't seen the Democrat plan. Well, have you seen the Democrat plan?
5 bills. You have none.
We have like 8 bills.
Eric Cantor. Where's Eric Cantor's plan? He promised it, what, 6 months ago?
Let me tell you.
Where is it? Where is
Nancy Pelosi's plan? I want to see Nancy Pelosi's plan. I haven't seen it. You're talking about we haven't seen it. It's in a backroom deal. Have a bill, have open process, open amendments, and see what happens.
Eric Cantor's plan? Have you seen a Republican leader?
Have you seen a Democrat plan? You haven't seen it.
We do have it. Chuck Grassley told a guy to go to work for the federal government.
And
remember that? That was a highlight.
Because Alan Grayson told us what the Republican plan is. Don't get sick.
Gentlemen, good discussion.